Calm down, I'm a doctor. The commanding words of Amelia Carter cut through the chaos and panic that had erupted in the marble foyer of Tariq al-Mansouri's Beverly Hills mansion, as the 62-year-old oil magnate clutched his chest and collapsed onto the Italian marble floor. For 30 seconds, the assembled dinner guests, all wealthy socialites and business leaders, had stood frozen in shock as their host suffered what appeared to be a massive heart attack in front of them. But the 41-year-old African-American woman, who had been quietly serving hors d'oeuvres moments earlier, now knelt beside Tariq with the calm efficiency of someone who had handled medical emergencies countless times before, her hands already checking his pulse and assessing his breathing, while the people who considered themselves his social equals remained paralyzed by fear and uncertainty. The transformation was so dramatic that several guests initially thought they were witnessing some kind of performance or practical joke. The woman they had barely noticed throughout the evening, someone whose presence had been as invisible as the expensive artwork on the walls, was suddenly the most important person in the room, taking charge of a life-threatening situation with professional authority that commanded immediate respect and attention. "Move back and give him space to breathe," Amelia ordered, her voice carrying the kind of medical authority that made people obey without question. "Someone call 911 immediately and tell them we have a 62-year-old male experiencing acute chest pain and shortness of breath. Someone else bring me any aspirin you can find in the house, preferably chewable, and clear a path to the front door for the paramedics." The dinner party had been one of Tariq's elaborate social gatherings, designed to impress potential business partners and reinforce his standing among Los Angeles's wealthy elite. 50 of the city's most powerful and influential people had been invited to his $20 million mansion to discuss investment opportunities in Middle Eastern oil ventures and to network with others who shared their level of wealth and social status. Amelia had been hired through a high-end catering service to help serve the event, working alongside a team of other service professionals who were expected to remain inconspicuous while ensuring that every guest's needs were anticipated and met. For 3 hours, she had moved through the crowd, offering drinks and appetizers, listening to conversations about stock portfolios and real estate investments, while remaining essentially invisible to people who saw domestic workers as part of the furniture rather than as human beings with their own stories and definite qualifications. But when Tariq suddenly gasped, grabbed his chest, and fell to the floor in the middle of a conversation about oil futures, Amelia's medical training instantly activated, overriding the social expectations that required her to remain silent and deferential. 20 years of emergency medicine experience took precedence over her role as hired help, and she immediately began implementing the protocols that had saved countless lives during her career as a trauma surgeon. As she worked to stabilize Tariq and prepare him for transport to the hospital, the assembled guests began to process the shocking realization that their host's life was being saved by someone they had been treating as invisible and unimportant throughout the evening. The cognitive dissonance was profound, challenging fundamental assumptions about social hierarchy, professional competence, and the relationship between wealth and worth. Mrs. Pemberton, whose family controlled one of the largest pharmaceutical companies in the country, was the first to voice what everyone was thinking. "Are you actually a doctor?" she asked, her tone mixing skepticism with grudging recognition that Amelia clearly knew what she was doing. 23 years of emergency medicine, including 15 years as chief of trauma surgery at Los Angeles General Hospital, Amelia replied, without looking up from her patient, her hands continuing to monitor Tariq's vital signs while she assessed the severity of his condition. "I retired 2 years ago after a malpractice lawsuit destroyed my career, and I've been working service jobs to pay my legal bills and support my family." The revelation sent shockwaves through the gathered crowd of wealthy socialites, none of whom could comprehend how someone with such impressive medical credentials could end up serving drinks at their dinner parties. The idea that a former chief of surgery would be reduced to working as hired helped challenge their comfortable assumptions about meritocracy, social mobility, and the relationship between talent and economic success. But Amelia had no time to explain the complicated circumstances that had led to her current situation. Tariq's condition was critical, and her immediate focus had to be on keeping him stable until professional medical help arrived. His pulse was weak and irregular, his breathing was labored, and his skin color indicated that his heart was struggling to pump blood effectively throughout his body. "You're having a heart attack, but you're going to be okay," she told Tariq, her voice calm and reassuring despite the severity of the situation. "I need you to stay conscious and try to breathe slowly and deeply. The paramedics will be here in a few minutes, and we're going to get you to the hospital where they can provide the treatment you need." Tariq looked up at her with confusion and gratitude, struggling to understand how the woman who had been serving his guests was now saving his life with obvious medical expertise. The pain in his chest was excruciating, but Amelia's professional confidence and gentle bedside manner provided reassurance that helped him remain calm despite his fear and physical distress. As they waited for the ambulance to arrive, Amelia continued to monitor Tariq's condition while fielding questions from guests who were trying to process what they were witnessing. Her medical knowledge was clearly extensive and current. Her emergency procedures were textbook perfect, and her calm authority in a crisis situation was exactly what would be expected from someone with decades of experience in trauma medicine. "Dr. Carter," said Robert Chen, a tech mogul whose fortune exceeded $2 billion. "If you're a former chief of surgery, how did you end up working as serving staff at dinner parties?" The question everyone wanted to ask, but had been afraid to voice. Amelia's answer revealed a story of professional destruction that was both heartbreaking and infuriating. A cautionary tale about how the medical establishment could destroy even the most competent physicians when legal and political forces aligned against them. "3 years ago, I was sued for malpractice after a patient died during emergency surgery," she explained while continuing to monitor Tariq's pulse and breathing. "The patient was a prominent businessman whose family had political connections, and they blamed me for his death, even though the surgery was performed correctly and his condition was essentially untreatable by the time he reached the hospital." She continued, "The lawsuit lasted 2 years and cost me everything. My malpractice insurance company settled out of court for $10 million rather than fight the case, which meant that my professional reputation was destroyed even though I had done nothing wrong. No hospital would hire me after that, and I lost my medical license pending an investigation that took another year to clear me of any wrongdoing." The gathered guests listened in stunned silence as Amelia described how a successful medical career spanning 2 decades had been destroyed by a single malpractice lawsuit that had more to do with politics and money than with actual medical negligence. Her story revealed the dark side of American healthcare, where even competent physicians could be ruined by lawsuits that prioritized financial settlements over professional justice. "By the time I was cleared of any wrongdoing and had my license reinstated, I had spent over $300,000 on legal fees, lost my home to bankruptcy, and been blacklisted by every major hospital in Southern California," Amelia explained. "I've been working service jobs for the past 2 years, trying to rebuild my financial stability while looking for medical positions that will consider hiring someone with a malpractice history." The paramedics arrived just as Amelia finished her explanation, taking over Tariq's care with the kind of professional respect that recognized her obvious medical expertise. They immediately implemented the same protocols she had been following, confirming her diagnosis and treatment approach while preparing him for transport to Cedars-Sinai Medical Center. "Doctor," said the lead paramedic, addressing Amelia with the professional courtesy that her medical knowledge clearly warranted, "your preliminary assessment and treatment probably saved his life. He's stable enough for transport, but he's going to need immediate cardiac intervention at the hospital." As Tariq was loaded onto the ambulance stretcher, he grabbed Amelia's hand with surprising strength. "You saved my life," he whispered, his voice weak but filled with genuine gratitude. "I don't understand how someone with your skills ended up serving at my dinner party, but I'm grateful that you were there when I needed you." The ambulance departed with Tariq stabilized but still in critical condition, leaving behind a group of wealthy socialites who were struggling to process what they had witnessed. The woman they had ignored and dismissed throughout the evening had demonstrated medical expertise that exceeded anything they could have provided, revealing their own limitations and prejudices in ways that made them deeply uncomfortable. Over the following days, as Tariq underwent successful cardiac surgery and began his recovery, the story of how his life had been saved by a former trauma surgeon working as hired help spread throughout Los Angeles's wealthy social circles. The tale challenged comfortable assumptions about social hierarchy and forced many people to reconsider their attitudes towards service workers and the economic circumstances that drove qualified professionals into unexpected situations. Tariq's recovery provided him with time to reflect on the evening's events and to investigate Amelia's background more thoroughly. What he discovered was both inspiring and outrageous. A story of professional excellence, destroyed by a corrupt legal system that prioritized political connections over medical competence. Dr. Amelia Carter had indeed been one of the most respected trauma surgeons in Los Angeles, with a track record of successful emergency procedures that had saved hundreds of lives over 2 decades. Her medical school achievements had been exceptional, her residency performance had been outstanding, and her career advancement had been based entirely on merit and professional competence. But the malpractice lawsuit that destroyed her career had been orchestrated by powerful interests who needed a scapegoat for a patient's death that was actually unavoidable. The businessman who died had been brought to the hospital with massive internal injuries from a car accident, and no surgeon in the world could have saved him given the extent of his trauma. But his family's political connections and financial resources allowed them to pursue a lawsuit that blamed Amelia for failing to perform a medical miracle. The legal battle had been expensive and emotionally devastating, forcing Amelia to spend her life savings on attorney fees, while watching her professional reputation be systematically destroyed by media coverage that portrayed her as incompetent and negligent. Even after being cleared of all wrongdoing, the damage to her career was irreversible, as hospitals were reluctant to hire physicians with any malpractice history, regardless of the circumstances. What made the situation even more tragic was that Amelia had been one of the most innovative and dedicated physicians in emergency medicine. Her research on trauma protocols had saved thousands of lives across the country, and her training programs had educated a generation of emergency room doctors who carried her techniques to hospitals nationwide. She had pioneered new approaches to treating cardiac emergencies, developed protocols for handling mass casualty events, and written medical textbooks that were still used in training programs around the world. But none of her professional achievements mattered once the malpractice lawsuit destroyed her reputation. Medical administrators who had once competed to recruit her now avoided her calls. Colleagues who had praised her expertise suddenly distanced themselves from any association with her case. The medical establishment that had benefited from her innovations abandoned her completely when she needed support most. The personal cost had been devastating beyond just financial ruin. Amelia's marriage had ended during the legal battle, unable to withstand the stress and uncertainty of fighting a 2-year court case while watching their savings disappear. Her 2 teenage children had been forced to leave private school and move to a smaller apartment when the family home was sold to pay legal bills. The shame and isolation of being publicly accused of medical negligence had taken a psychological toll that affected every aspect of her life. During the darkest period of the lawsuit, Amelia had seriously considered leaving medicine entirely and starting over in a completely different career. The thought of never practicing medicine again was heartbreaking, but the alternative of continuing to fight a system that seemed determined to destroy her felt equally impossible. It was her daughter Sarah who convinced her to persevere, pointing out that giving up would mean that the people who had falsely accused her would win completely. If you stop being a doctor because of their lies, Sarah had argued, then they will have succeeded in taking away not just your career, but your identity and your ability to help people who need you. Tariq was appalled by what he learned about the medical and legal systems that had destroyed such a talented physician's career. As someone who had built his fortune through merit and hard work, he understood the injustice of seeing competence punished and excellence undermined by political and financial manipulation. His investigation revealed that the malpractice lawsuit against Amelia was part of a broader pattern of corruption that affected healthcare throughout Southern California. Wealthy families with political connections routinely used frivolous malpractice suits to intimidate physicians and hospitals into providing special treatment or covering up medical issues that could be embarrassing or legally problematic. The businessmen whose death had triggered Amelia's lawsuit had been involved in money laundering operations that made his family eager to avoid autopsy results that might reveal evidence of drug use or other activities that could attract law enforcement attention. Blaming his death on medical malpractice had been a convenient way to deflect attention from the real circumstances, while also intimidating other physicians who might ask inconvenient questions about similar cases. But Tariq was also impressed by Amelia's resilience and character in the face of professional destruction. Rather than becoming bitter or abandoning her commitment to helping others, she had continued to use her medical skills whenever opportunities arose, while working whatever jobs were available to support her family and pay off her legal debts. During their conversation at the hospital, Tariq learned that Amelia had been volunteering at free clinics during her time away from formal medical practice, providing healthcare services to homeless populations and undocumented immigrants who couldn't access traditional medical care. Her work in these settings had kept her medical skills sharp, while also giving her insight into healthcare disparities that she had never fully understood during her career, treating wealthy patients at prestigious hospitals. The contrast between her current volunteer work and her previous career at Los Angeles General Hospital had opened her eyes to the vast inequalities in American healthcare. The wealthy patients she had treated during her formal career had access to unlimited medical resources, while the poor patients she now served in free clinics often went without basic care that could prevent serious health problems. When Tariq was discharged from the hospital 2 weeks later, his first priority was arranging a meeting with Amelia to discuss how he could help restore her medical career and ensure that her talents were properly utilized. The conversation that followed revealed the depth of her commitment to medicine and her determination to continue serving others despite the obstacles she faced. "Dr. Carter," Tariq said during their first formal meeting since the night she had saved his life, "what happened to your career is not just a personal injustice. It's a loss for every patient who could benefit from your expertise. I want to help you get back into medicine where you belong, but I also want to understand what you've learned during your time away from formal practice." Amelia appreciated his gratitude and his offer of help, but she was also realistic about the challenges she faced in rebuilding her medical career. "Mr. Al-Mansouri, I'm grateful for everything you're saying, but the medical establishment has essentially blacklisted me. Even with my license reinstated, most hospitals won't consider hiring someone with a malpractice history, regardless of the circumstances," she continued. "But I've also learned things during the past 2 years that I never understood when I was working at prestigious hospitals treating wealthy patients. I've seen how people without insurance delay seeking medical care until their conditions become life-threatening. I've treated children whose asthma could be controlled with basic medications that their families can't afford. I've watched people die from preventable diseases because they couldn't access the healthcare system until it was too late." Amelia's experiences working with underserved populations had given her a perspective on healthcare that most physicians never developed. She understood firsthand how social determinants of health affected medical outcomes, and how the healthcare system often failed the people who needed it most. But Tariq had resources and connections that could overcome the institutional barriers that had kept Amelia out of medicine. As a major philanthropist who had donated millions to medical research and hospital construction, he had influence with healthcare administrators who would listen to his recommendations about talented physicians who deserved second chances. "What if we created something new?" Tariq suggested. "Rather than trying to force your way back into a system that has already demonstrated its injustice. What if we established a medical facility that could utilize your expertise, while also addressing the healthcare disparities you've observed during your volunteer work?" The idea intrigued Amelia because it offered a way to return to medicine while also serving the populations that had been most meaningful to her during her exile from formal practice. She had always been motivated by the challenge of saving lives during medical emergencies, but her volunteer work had shown her that preventing medical emergencies through accessible primary care could be equally important. Over the following months, Tariq used his wealth and influence to create opportunities for Amelia to return to medicine in ways that utilized her skills while rebuilding her professional reputation. He funded a new emergency medicine clinic in an underserved area of Los Angeles, with Amelia as medical director, providing healthcare services to communities that had been neglected by the traditional medical establishment. The clinic design incorporated everything Amelia had learned about both emergency medicine and healthcare accessibility. The facility included state-of-the-art emergency treatment capabilities, but also primary care services, preventive medicine programs, and community health education initiatives that addressed the social factors that contributed to medical emergencies. Staffing the clinic required recruiting healthcare professionals who shared Amelia's commitment to serving underserved populations while maintaining the highest standards of medical excellence. Tariq's funding allowed them to offer competitive salaries and benefits that attracted talented physicians, nurses, and support staff who wanted to work in an environment that prioritized patient welfare over profit margins. The clinic became a model for how experienced physicians who had faced career setbacks could continue serving patients while rebuilding their professional standing. Amelia's medical expertise and compassionate patient care quickly established the facility's reputation for excellence, attracting other talented healthcare professionals who wanted to work in an environment that valued both clinical competence and social justice. Dr. Martinez, a cardiologist who had been blacklisted for whistleblowing about unnecessary procedures at a for-profit hospital, joined the clinic as Director of Cardiovascular Services. Dr. Patel, an emergency physician who had lost her position for refusing to discharge uninsured patients prematurely, became Associate Medical Director. Dr. Johnson, a family practitioner who had been fired for spending too much time with low-income patients, established the clinic's primary care program. Within 2 years, the clinic had become one of the most respected emergency medical facilities in Southern California, serving thousands of patients who might otherwise have gone without adequate health care. The facility's outcomes exceeded those of much larger and better-funded hospitals, demonstrating that excellent medical care could be provided efficiently and compassionately when physicians were allowed to focus on patient welfare rather than profit maximization. Amelia's leadership and medical skills were recognized by her peers, and she began receiving offers from major hospitals who wanted to recruit her for senior positions. Medical journals published articles about the clinic's innovative approaches to emergency medicine and community health, restoring Amelia's reputation as one of the most talented and forward-thinking physicians in her field. The success of the clinic also helped expose the injustices that had destroyed Amelia's original career. Investigative journalists began examining the malpractice lawsuit that had ruined her reputation, discovering evidence of corruption and manipulation that vindicated her professional competence while revealing the political motivations behind her persecution. The investigation revealed that the law firm that had pursued the malpractice case against Amelia had financial relationships with the family of the deceased businessman, creating conflicts of interest that should have disqualified them from representing the plaintiffs. Court documents showed that witnesses had been coached to provide false testimony about Amelia's performance, and that medical experts had been paid to offer opinions that contradicted established medical knowledge. Most damaging was the discovery that the deceased businessman's family had known that his injuries were fatal before the surgery began, but had pursued the lawsuit anyway as a way to deflect attention from his criminal activities and to establish legal precedents that would protect them from future medical scrutiny. When the truth about the fraudulent malpractice case became public, Amelia received apologies from medical institutions that had blacklisted her, along with offers to restore her position and reputation within the mainstream medical establishment. The insurance company that had settled the original case filed suit to recover the $10 million they had paid out, and several attorneys involved in the fraudulent case faced disciplinary action from the State Bar Association. But by then, Amelia had discovered that her greatest satisfaction came from serving underserved communities rather than wealthy patients who could afford the best health care that money could buy. The clinic had given her the opportunity to practice medicine in ways that aligned with her values, while also demonstrating that excellent health care could be provided to everyone, regardless of their ability to pay. The clinic that Tariq had funded grew into a network of community health centers that provided comprehensive medical services to low-income populations throughout Southern California. Amelia became a nationally recognized advocate for healthcare justice, using her experience to reform malpractice laws and protect competent physicians from politically motivated lawsuits. Her testimony before Congress about the corruption in malpractice litigation led to federal legislation that required disclosure of financial relationships between plaintiffs and attorneys, established penalties for pursuing frivolous medical lawsuits, and created protection for physicians who served underserved populations. The reforms prevented other qualified doctors from suffering the kind of professional destruction that Amelia had endured. Tariq's heart attack recovery was complete and successful, but he often reflected on how close he had come to dying because he had surrounded himself with wealthy people who possessed money but lacked the practical skills needed in medical emergencies. The woman who saved his life had been present but invisible, her expertise hidden by social assumptions that equated worth with wealth and status with competence. Before we wrap this story up, I'd like to thank you for reaching this far. And if you enjoyed this story as much as I think you did, then be sure to show your support by liking and subscribing to this channel. Now back to the story. The dinner party where he had nearly died became the last time Tariq judged people based on their apparent social position rather than their actual capabilities and character. He learned that wisdom, skill, and dedication could be found in unexpected places, while superficial wealth often masked profound limitations and moral failures. Most importantly, he discovered that using his resources to restore justice and create opportunities for talented individuals like Amelia provided more satisfaction than any business deal or social recognition he had ever achieved. The heart attack that could have ended his life instead began a new chapter focused on using his wealth to identify and support people whose abilities had been overlooked or suppressed by an unjust system. Dr. Amelia Carter proved that professional excellence could survive even the most determined attempts at destruction, and that the most valuable expertise often came from people who had been tested by adversity rather than protected by privilege. Her medical skills had saved Tariq's life, but her resilience and commitment to serving others had taught him what it meant to use wealth and influence for purposes more meaningful than personal advancement. The story of their meeting became a powerful reminder that life-saving expertise could be found in the most unexpected places, and that the people society treats as invisible often possess the greatest capacity to see and address what truly matters in moments of crisis.